What happened? Okay, sorry. Hi, my name is Ashley McCall, and I did the genetic disorder on Trisomy 21, also known as Down syndrome. The inheritance of Down syndrome is usually not inherited. It is an autosomal genetic disorder, and the abnormality occurs usually in the egg cells of the woman. It is neither dominant or recessive. This genetic order is not inherited. The disease that causes trisomy 21 is caused by an extra chromosome, which usually the human has two chromosomes, and people with trisomy 21 have three. It disrupts the normal development of the brain. Changes in trisomy 21 include facial features, speaking, health problems, etc. The protein paracentrin is affected, causing defects in cilia formation. Symptoms that can come with trisomy 21 usually come with small head, almond-shaped eyes, a tongue that usually sticks out, short and round heads. As you can see in this picture, the round face and the slanted eyes are usually the most common in physical characteristics. Intellectual disability, facial features, health issues, and physical appearance characteristics, like I just described. These characteristics call for lower levels of gene required for protein production. The diagnosis for trisomy 21 is during pregnancies, ultrasounds can be used to detect the diagnosis. Usually, whenever they are short in the pregnancy, they're able to detect it by the ultrasounds. Blood tests are also used as well. Diagnostic tests can be based on symptoms after the baby is born. So when the baby is born, usually physical appearances or a karyotype analysis is developed. A genetic test is available after the child is born. Disease prevalence. Each year, about 5,700 babies are born with trisomy 21. 1 in 700 babies are more likely to be affected by this disease each year, and the sex usually comes from the mom who has a child in her late 30s. So usually, whenever the mom is over the age of 35, that is when it is at highly risk for the child to have trisomy 21. It usually never comes from the dad. It's always usually from the mom. Treatments for trisomy 21, there are no cures for Down syndrome, unfortunately. Specific symptoms can be treated. Heart and gastrointestinal effects can be surgically improved. Diabetes, hypothyroidism, and celiac disease cannot be treated. These are just internal diseases that cannot be treated, and normally for a person with just two chromosomes, usually those can't be treated either. Diabetes is usually treated with insulin shots and stuff, but for trisomy 21, they cannot be treated. The prognosis, some live to be about 60 to 80 years old. Most of them are really healthy. If they are healthy, they usually live to be 60 and 80. It cannot be known at birth if the child will have long-term needs. That usually is proven after the child is born and grown up. They will need supervision most of their life. Due to the lack of brain improvement, they will need ongoing medical care. And as they reach older ages, they can develop Alzheimer's, leukemia, and sleep apnea. Also, I would like to point out that prognosis, as they grow older, they may get into bullying. I know that that's not a physical disorder or anything of that sort, but they can also go through that as well. And this will be my sources cited and my picture citation. Thank you.